Today on Dueling Doctors, we're putting pain in its place with tried and true treatments for things that make us feel miserable, like hemorrhoids, arthritis, and the caustic combination of acid reflux and heartburn. What's at the crux of these chronic issues? Different doctors from the world of holistic natural medicine and conventional Western medicine square off on pain management right now. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the world of both conventional Western medicine and natural holistic medicine join us to debate and discuss the best ways to treat what ails us. Let's get started by introducing our guest. Joining me from the Western Front and NYU Medical Center, we have accomplished internist and gastroenterologist and author of What the Yuck, I like the title, Dr. Roshni Raj. Did I say that right?
You got it right.
Close? Okay, good. And on the eastern side, from New York AccuHealth, licensed acupuncturist, Dr. Daniel Shu. Welcome.
Thank you.
First stop on our campaign to eliminate pain, we're going down there to our derrieres with a plan to heal hemorrhoids. Now, hemorrhoids are just enlarged veins that pop out in our anus and rectum. It can be due to straining, especially with constipation. And the symptoms can include pain, swelling. I normally tell patients it's like having a varicose vein of their anus. And even sometimes it can have blood when you wipe with toilet paper. So now we know what it is and what causes them. How can you heal them? Each of our experts has up to 1 minute to present a treatment plan, and then each will have the opportunity to respond to the other. We flipped a coin before the show to see who would go first, and guess what? Dr. Raj, you were the winner.
All
Congratulations.
Right.
So you're up first.
I get to talk about hemorrhoids.
So, yeah, please, help me with my hemorrhoids.
Okay. Well, first of all, as you said, they are just a swelling of some veins in that area, and they're benign. They're never going to grow into anything dangerous or worrisome, but they can definitely be annoying.
Very.
So what can we do? Number one, you want to stop that straining or pushing when you're going in the bathroom, because that can make the hemorrhoids worse.
Because you're actually just popping them out.
You are. You're
right.
putting pressure on those veins, and they're going to swell more.
Okay.
So you want to have more fiber, either in your diet or taking a fiber supplement like Metamucil or Citracel. I always recommend that as first-line treatment, in addition to drinking a lot of water. All of this is going to help soften the stool, so you're not putting as much pressure on those veins, and hopefully the hemorrhoids will shrink. If that doesn't work, I recommend trying an over-the-counter ointment that contains hydrocortisone, which is a mild steroid that can reduce the swelling and also help with the itching, or a cream that contains witch hazel, which comes from a plant that can also reduce swelling.
Okay, so I'm sorry.
Sure.
So dietary fiber,
Right.
maybe loosening up, drinking a lot of water, I get it.
Yeah.
And for when you have a hemorrhoid,
Yes.
applying maybe a topical that has hydrocortisone, because hydrocortisone, as we know, is an anti-inflammatory, which would
Correct.
shrink them.
Right.
And you also mentioned witch hazel, which is sort of natural, right?
It does, right?
Okay, so witch hazel is an astringent, so
Right.
you're actually causing it to shrink up.
Right.
So now what do you do for those pesky hemorrhoids that are just not going to go away?
Right.
Because, as you know, sometimes veins trap blood, and that blood clots.
Absolutely.
Thrombosed hemorrhoid is not going to
Right.
go. I don't care how much witch hazel you pour on that.
And that can be an excruciatingly painful situation. So if that happens and you literally almost can't sit down, it's so painful, that suggests there is a blood clot in the vein. That's something where you go to see the doctor right away, because we can just simply make a tiny incision. It sounds terrible, but you actually get a lot of relief if
Instantaneous relief.
Instantaneous, the
Right.
clot comes out and people feel 1,000
So
times better.
incision and drainage is
And
the
drainage,
procedure, because
right.
you want to remove the clot.
Right.
Are there other procedures? Do you recommend cryo, like freezing a hemorrhoid?
You can do that. I really only recommend that if these other measures have failed. But yes, if you've tried everything and you're still having persistent hemorrhoids, or if they're bleeding a lot and it's worrying you to see that blood all the time, there are procedures. One is called a rubber band ligation, where
Right.
literally you're putting little rubber bands around the
Yeah, you're
hemorrhoids.
just strangling them.
You cut off their blood supply, they wither away and go away. Cryo or injecting a sclerosis.
And all the time, I recommend, and I'm sure you do, sitz baths, where you just
I love the
sit
sitz
in
bath.
warm
Right.
water. Do you recommend sitz baths at
Well,
all?
interestingly enough, the treatments for hemorrhoids really hasn't changed in thousands of years. Thousands of
Yeah.
years. I mean, people have been having hemorrhoids, believe it or not, for thousands of years. So they would do pretty much the same thing. They would do sitz bath with herbs. They would also do
So let's just say
strangulation, ligation.
sitz baths
Sure.
is a German word, sitz bad, which literally just means
Right, sitting in a bath.
in warm water. You don't
Sure.
need to buy an appliance if you have a bathtub. you could just below the waist sit in warm water, not hot water.
Absolutely.
But just to soothe and calm everything that's going on down there.
And interestingly enough, there are two things that are done that are Eastern that are not so Western. You have the position that you go to the bathroom. In Eastern countries and in a lot of other countries also, when you go to the bathroom, you don't just sit on the toilet, you can also squat. And when you squat down, you're actually changing the angle of your colon. And so instead of being slightly bent, it's slightly straight. There's no more of the muscle that's actually holding onto it.
I
so there's
agree
less
with you.
straining involved.
But
when
if
you go to
you're
the bathroom.
constipated and your stools are very
constipated,
bulking, really the position would help, but it's still
Yes.
going to irritate, inflame.
Sure. And even a doctor traditionally would say just drink more fluids, eat more fiber, and it's that's the same thing. You go back in time, 5,000 years to India, the doctor would tell you the same thing in China, and India, and Rome, wherever you went.
But fortunately, surgery has gotten a lot better if you have really annoying hemorrhoids that don't go away, and sometimes for some people they don't, especially in pregnant women, they happen a lot.
Absolutely.
And just having, I think, you have to develop a regimen with your patients, especially I tell my patients if they have recurrent hemorrhoids, sitz bath, what do you recommend? Every day, if that's the case?
If they have a current hemorrhoid at that time, I recommend 2 or 3 times a day. And you mentioned the bathtub. It's not convenient to take a bath 2 or 3 times a day, but when you go to the pharmacy, you ask for that plastic apparatus, which is a sitz bath, and you can attach it to your toilet and just soak in that area 15, 20 minutes. I mean, I've had 2 kids.
Do you put anything in the water?
I don't. I just think regular warm water.
Warm water. Now, what role would acupuncture play?
Acupuncture is interesting. There's actually a couple of points in acupuncture. One in the back, it's on the back in the sacral area called Mingmen.
So in the lower back.
Right, and that's for that's for hemorrhoids.
It's called the hemorrhoid spot.
Well, it's a point for hemorrhoids. There's another interesting spot that's actually between your tailbone and your anus. That is also for hemorrhoids, and that's not used that often because of obvious reasons. It's kind of a really kind of uncomfortable position to be in. And
but this is going to relieve your hemorrhoid,
when you do these points, the hemorrhoid. It's funny. It's true. The hemorrhoid actually just kind of sucks right in the moment you do it.
Do you have that on video? Because I'd really like to see.
You want to see the video?
Yeah.
Sure.
Let's go to the videotape, okay? All right. I think we've had a lot of information on hemorrhoids. We're going to take a break. Coming up next, we're going to give arthritis the axe. Welcome back to Dueling Doctors, the show where health experts from the world of traditional Western medicine and holistic medicine debate the best ways to treat ailments that affect us all. Today's topic, pain management. We're joined by licensed acupuncturist and doctor of traditional Chinese medicine, Dr. Dan Xu, along with gastroenterologist and author, Dr. Raj. We've already covered some of the best ways to banish hurtful hemorrhoids. Now we're moving on to arthritis, a condition that burdens about 50 million adults in this country. Osteoarthritis is probably the most common degenerative bone disease. And what happens is that over time, the cartilage that wraps around long bones wears away with age and wear and tear. So instead of that gliding, smooth formation against bone on bone, we're actually getting bone on bone, and that's what's giving you the arthritic pain. Now you know what it is. Each of our doctors has up to 1 minute to present a treatment plan, and then the other will be given the chance to debate the pros and cons. Dr. Raj, you went first, so we're going to start up with Dr. Xu.
Arthritis is a condition, obviously, that people have been getting and experiencing for thousands of years. And in traditional medicine in China, they have used acupuncture and herbs forever. And acupuncture has there are really good studies about it that show that acupuncture blocks the pain by telling the brain to kind of ignore the pain. So it does it in a number of ways. Does it also have an
actual anti-inflammatory effect as well?
It can have an anti-inflammatory effect, and there are research that does say that it can do that. Okay. The main way that it does it, though, is to create those natural painkillers in the body. And there are also a lot of great topical herbs that you can put onto the area where there is inflammation.
What do you think is the best way to prevent? I mean, obviously you want to maintain a healthy weight.
The way to prevent it is the same now as it was, thousands of years ago. Exercise, movement.
What exercises particularly do you recommend?
Well, in traditional cultures, you have Tai Chi, and also yoga was very popular.
Tai Chi exactly is what? Because I always see people in the parks doing it. Is it the slow, nice?
It can be slow, it can be fast. They're all different kinds, but it's movement.
I think Tai Chi probably is the best thing for osteoarthritis.
It's great for movement. It's also, Tai Chi is also great for cardiovascular issues, but arthritis, it's also fantastic.
I also recommend swimming. What do you think of that? It's very low impact.
Swimming, anything that's low impact, swimming is excellent.
So swimming, Tai Chi.
Yeah, just movement in general.
And so acupuncture, is there anything you could take orally, like an herb that you recommend, or anything topical?
Right. The topical herbs are, for example, we use topical herbs placed on the joint. They're a mixture of frankincense and myrrh, are two of the really good.
Oh, like they gave to baby Jesus. You take frankincense, myrrh, not gold, obviously, and you can make.
You can put gold in it, but it wouldn't work very well.
All right, if you're rich, I guess.
Gold you give to the doctor.
And so that's a topical pain reliever as well.
Topical pain.
And I also know capsaicin also works.
Capsaicin works and all those other kinds of things. So menthol, there's a lot of
Well, it's interesting because you mentioned how acupuncture can sort of trick the brain into focusing on something else in a way.
Yeah, it's something called a gate theory.
Right, and capsaicin works in the same way. You know, it sort of creates that very warm sensation, and the body sort of interprets the pain signals differently, and so you don't feel pain anymore, you feel the warmth. And so we use those kinds of rubs as well, and ointments, as well as, of course, the more traditional, anti-inflammatory medications.
Yeah, because let's face it, the mainstay, what I think patients do is they're getting older, they realize they have joint pain, they call it arthritis, and they don't go to you. They go to the pharmacy and they grab some ibuprofen, Motrin, Advil, whatever it is, they take boatloads of it, and then they come to you because you're a gastroenterologist because you have an ulcer. Because that's a huge side effect. But they're still in pain. So I think what a lot of people expect from their doctors is to go to the prescription grade NSAIDs, the non-steroidal anti-inflammatories, which still have a lot of side effects.
Yeah, absolutely.
So, I mean, what is your protocol? Is it what are you using orally from the pharmacy, and then let's see if you qualify or you really should be on an NSAID?
And I mean, you know, as a gastroenterologist, as you said, I am very leery of the anti-inflammatories, whether they're over-the-counter or prescription strength, because they absolutely can damage your stomach, but sometimes they are necessary. And when we're talking about arthritis, there is literally an inflamed joint there, and sometimes the only thing that's going to work is an anti-inflammatory. But really counseling patients on how to use them properly, the correct doses, you know, do it with food or use the coated form of it. Take an acid blocker potentially to protect your stomach while you're doing it. But there are other things. I mean, maintaining a healthy weight is probably one of the most important things you can do to prevent osteoarthritis.
And exercise.
And exercise. And physical therapy is another thing we didn't talk about. That is another modality that can help.
I want to talk about something else we didn't talk about, which happened to me because I actually tore a meniscus and they were trying to prevent me from developing arthritis, and they recommended chondroitin sulfate and glucosamine. Do you guys actually tell patients, I think this is a great idea? Because a lot of studies show that this is natural and it actually works by rebuilding the cartilage and helping with the pain. So I don't know, how you guys weigh in?
I feel that the studies are kind of mixed on that. So right now I'm not advocating it, but I'm not sure what you think.
Well, that's not really in my circle. I think that if it doesn't absolutely hurt you, it can be worth a try. But
see, I feel it's worth a try. I haven't read any studies that say there's absolutely something wrong with it or a side effect profile. And I think I would give it a try before patients just became dependent on ibuprofen or an NSAID or something like that.
Or even, you know, stronger opioid painkillers, which Percocet, things like that, people prescribe as well for this, and that can become very addictive.
So in addition to oral medications, what do you feel is the role of injections?
So a steroid injection, so injecting a steroid, which is a very potent anti-inflammatory, right into the joint can be very effective, but it's usually a short-term solution. It's not going to last forever.
Yeah, it's a temporizing effect. But couldn't it also have an adverse effect on bone? I hear a lot of patients tell me they went to their doctor and they kept getting steroid injections, and I'm like, I don't think that's a really good idea in the long run.
In the long term, cumulative steroid use can definitely, you know, cause osteoporosis and decrease the strength of your bone. So you don't want to use it too much, and if you find that you're requiring that many injections, it may unfortunately be time to actually do surgery on that joint rather than
Which you do not want to be on an NSAID if you're going to have surgery.
Right, exactly.
Well,
and before you try surgery, try everything else first, including the acupuncture and the herbs.
That's true.
All right, we got it, Dr. Shear. Thank you both very much. We're going to take a quick break. When we come back, heartburn and acid reflux sufferers, you can rejoice. Our panel has some surefire solutions to soothe your system. Welcome back to Dueling Doctors and one of the most popular topics, how to cope with chronic pain. Our final topic is one that has triggered tons of attention, heartburn and acid reflux. Now, heartburn has nothing to do with your heart. It's gastroesophageal reflux disease. When you eat, food goes down the esophagus into the stomach where it's dissolved by acid. But sometimes it can backsplash back up into your esophagus if the sphincter isn't tight enough. This can lead to intense pain, and this can change the mucosa of your esophagus, and over time you can develop something called Barrett's esophagus and even cancer. Now, each of our doctors has up to 1 minute to present a treatment plan. Dr. Raj, help me with my heartburn.
All right, I'd be happy to. So first of all, you want to look at your diet, number one, because there are certain foods that contain more acid, or they actually cause a loosening of that sphincter you were talking about between the esophagus and the stomach.
So there are actual foods that can cause this actual sphincter not to close properly.
That's right.
And that's why the contents is going back.
Correct.
Like, what
caffeine
food would that be?
is number one. So
Coffee,
anything that has
especially.
caffeine, coffee, tea, sodas, the dark colas.
We never drink soda anyway, right? No coffee.
No,
I don't,
no.
no.
Come on.
And speaking of sodas, carbonated beverages, even if they don't have caffeine, all those gas
Lots of
bubbles
gas.
are going to push
Right.
everything upwards. Then you want to avoid the citrus fruits or juices. So orange, lemon, grapefruit has a lot of acid in it, of course.
Okay.
And then some things people don't know a lot about, like peppermint actually can cause a lot of
Peppermint
acid
causes that
reflux.
Even spearmint as well.
Spearmint, any greasy, fatty meal, that can also cause a loosening of the sphincter. So I first talk to patients about their diet, then I talk about their eating habits. You don't want to have 3 large meals a day, but break it up into smaller meals more frequently. Again, because you don't want the stomach to expand too much, which will push things
Put
up.
more pressure,
you don't
right.
want to eat late at night because, when you're lying down, gravity is no longer helping you. All the food contents can just go right back up there.
Right. And
So
you don't want to
be
eat
upright.
before you exercise either. for the
Right,
same
because things are
reason.
jostling up and down, exactly. But if those measures don't work, then we do talk about some medications. We start with the over-the-counter acid blockers. Something as simple as Tums or Mylanta may work if it's a very mild case. But if not, you go on to what's called an H2 blocker, something like Pepcid or Zantac, which is a milder acid blocker. And if that doesn't work, the stronger ones, which are called proton pump inhibitors, Prevacid, Prilosec, which now come in over-the-counter versions, or if necessary, the prescription strength version
See, now
of
the
that.
problem there again is these are all available over the counter, whereas they used to be prescription grade. And I think, once again, we're falling into that trap of doctor-patient. They're just prescribing these things for themselves. And oftentimes, patients will come in, they won't even tell you they're on an H2 blocker like Pepsi, because they're just chewing them like candy, or a
And that's
proton
a
pump inhibitor. And there's a
problem,
lot of side effects with some of these, especially like nausea, vomiting, and even some of these proton pump inhibitors can leach calcium, which could lead to osteoporosis. And I don't
Long-term,
think
you're right, yes.
patients look at side effects because they think it's available over the counter, therefore
Always
it's
a
good
mistake.
enough for me to take. There's no side effect.
Absolutely. And the other problem is, like you said, there is a risk of esophageal cancer here. So if you're just treating yourself and not seeing a doctor, you might not be addressing a serious problem.
Exactly.
Well,
All right,
with the
Dr.
traditional medicines, we don't really recommend taking the acid reducers. We recommend the smaller meals, which is really good. Because the acid reducers, you actually need that stomach acid to help you digest food. And once you don't have that anymore, it stops, the food doesn't get digested as well. So we do acupuncture and we do herbs to help the food to actually digest quicker and better through the body.
So acupuncture again.
Yeah, there's a
as
very
way
famous
of
acupuncture point that's 2 inches above the wrist here, right in between there. It's called neoguan. It's in the pericardium channel. Pericardium 6 is a number.
Right.
And there's actually a lot of good research on it that shows that it actually slows down up to 40%, stops those loosenings of that sphincter you talked about. That's
The sphincter, right?
It's a
Lower
transient
esophageal
lower esophageal sphincter loosening. It just actually tightens it up.
So both of you agreeing that at least we know that it's the lower esophageal sphincter.
It absolutely is that. And then there's also Eastern herbs that are used very, very popularly.
For instance?
In India and China, they use fennel.
Fennel, very good.
Fennel is very, very good. Ginger tea, that kind of stuff. It's very,
I think
very good
ginger
at
tea
settling
should
the
be in
stomach.
everybody's
So
house.
yeah.
What I wanted to ask you is, there seems to be a discrepancy in the theory of whether or not it's too much acid that's being produced or not enough acid at all. And I find that naturopaths tend to think that it's achlorhydria. There's low acid, so sometimes even giving acid would help.
Well, there's some people that think in natural medicine that when you give acid, you actually are helping the food to digest faster.
Which is very counterintuitive to what I think.
Yeah, I mean, we would never give acid to someone who is suffering from acid reflux because we think it would make it worse.
But I have heard the argument
one of the
that it
keys
would.
is to help the food digest quicker. And so you eat smaller meals, which is very obvious, and you avoid all the foods that give you reflux, spicy foods you don't want to eat. So, and then once you eat the smaller meals, the extra things that you add help the food digest better, and there's less that comes out.
Well, that was very, very good information. We need to wrap things up. I want to thank you both for joining us today. Coming up, my spin on coping with chronic pain. We'll be right back. Managing painful issues becomes of the utmost importance in our lives because being in pain affects your daily routine. If you are prone to hemorrhoids, try to evaluate whether you suffer from constipation. If so, drink plenty of water and increase dietary fiber. For arthritis, maintain a healthy body weight and engage in low-impact exercise like Tai Chi and swimming. If heartburn is an issue, eat frequent, smaller meals and don't eat before bedtime or before exercising. Also, avoid spicy food, alcohol, coffee, and chocolate. Try not to reach for a quick fix at the local pharmacy. Remember, even over-the-counter medication has side effects. I'm Dr. Frank Spinelli. Hope to see you soon for more healthy discussions on Dueling Doctors. And no matter what medical path you're on, I hope you've been inspired to come up with a plan for your own personal prescription for health and happiness. And as always, be sure to talk to your doctor first before making any medical decisions. See you next time.